In today's video tutorial, we'll cover the origin and insertion of the muscles of pectoral region. Pectoralis major, pectoralis minor, subclavius and serratus anterior are muscles of pectoral region. First we see the origin and insertion of pectoralis major. So these two muscles, bulky muscles in front of chest are the pectoralis major muscles. I'll just remove the pectoralis major of one of the sides so that the bones on which these muscles are attached they can be better seen. We'll keep on removing a few muscles, and the muscles of pectoral region they itself are arranged in layers, so I will one by one remove the layer and you will be able to see the deeper muscles. So pectoralis major is the most superficial one, and you can see here that I'll remove platysma from here, and you can see that pectoralis major muscle, it takes origin from the clavicle, it takes origin from the sternum, and it takes origin from the aponeurosis of one of the muscles of abdomen. So it has three heads of origin. That is, it has a clavicular head of origin, and this clavicular head is basically taking origin from the medial two-thirds of the anterior surface of clavicle. It has a sternocostal head which is taking origin from the anterior surface, half the breadth of manubrium and sternum up to 6th costal cartilage, and the abdominal head is taking origin from the aponeurosis of the external oblique muscle. So I'll remove the rectus muscle from here. You can see this is the aponeurosis of the external oblique muscle, and this is pectoralis major abdominal head taking origin from the aponeurosis of external oblique. In order to see the insertion, I will remove deltoid from here and all the other muscles of the arm so that a better visualization of humerus can be done, as pectoralis major is inserted into the humerus bone, the bicipital groove of the humerus, the lateral lip of the bicipital groove, in the form of an inverted U-shaped tendon. The muscle is inserted. So this muscle here is the pectoralis major muscle. I will remove pectoralis major so that we can visualize this tiny muscle below the pectoralis major, which is the pectoralis minor muscle. And to better see its origin and insertion, we will remove a few other structures. Pectoralis minor muscle basically takes origin from the third, fourth, and fifth rib near the costochondral junction. So here you can see that this is the second rib, this is the third, fourth, and fifth rib, and costochondral junction is this junction between the costal cartilage and the ribs. So the muscle, pectoralis minor muscle, taking origin from the third, fourth, fifth rib and getting inserted into the coracoid process of the scapula. This is basically the scapula bone. This bone is a scapula bone, and this is the coracoid process of the scapula. The next muscle is the subclavius muscle. Subclavius muscle is this tiny muscle here. It is taking origin from the first rib at the costochondral junction. So as I said, this is the second rib. So here is the first rib. At the costochondral junction, the muscle takes origin and it gets inserted into the clavicle. So basically, in the clavicle, there is a subclavian groove in the clavicle. In its middle part on the inferior surface, there is a groove which is known as subclavian groove, and that is where the subclavius muscle is inserted. The next muscle that we will see is the serratus anterior muscle. I will remove pectoralis minor, I will remove clavicle and subclavius, because then only we will be able to have a better visualization of the 8 digitations of the serratus anterior muscle. So serratus anterior, it takes origin from the upper 8 ribs in 8 digitations in the mid axillary line. You can see that this muscle is present in the side of the chest. And it also takes origin from the fascia that's intervening the intercostal spaces muscles. So this serratus anterior muscle, you can see here, this muscle, it turns around the chest wall and it is inserted on the scapula. This is the scapula bone. I will remove humerus from here and I'll remove these other muscles so that we can just expose scapula bone, and you can have a proper understanding as to how the muscle, the serratus anterior muscle, is inserted and how it is actually related with the scapula bone. So the serratus anterior is inserted into the scapula, that is the medial border, costal surface. Its first digitation is inserted in the superior root of the spine. From second to third, they are inserted on the medial border, and from 4 to 8 on a large triangular area over the inferior angle. The pectoralis major and minor muscles, they are supplied by the medial and lateral pectoral nerve. Subclavius muscle is supplied by the nerve to subclavius, and serratus anterior muscle is supplied by the nerve to serratus anterior or the long thoracic nerve. So that was all about the muscles of the pectoral region. Thank you so much for watching.